Both Ken and I work for the Bethel School District. We've been here since 2006. We have started off with the Cadillac plan, as you would call it. Due to the rising cost of health insurance, we have had to downsize to the least expensive plan. Even that plan is still very expensive for our family. He made a decision a year ago to enlist into the Washington National Guard for the cost of health insurance. It's a pretty significant impact because he is due for deployment to the Middle East. He enlisted into the National Guard in December of 2010, and 3 months later was told, "You'll be deploying." So it's a huge impact that our family has had to take on. It's a sacrifice that I don't think any family should ever have to take, to make a sacrifice like this in order to provide basic care for their family. Insurance is a need. It's not a want. Insurance is a must-have for any family. This is horrible for our daughters. Our youngest daughter is special needs, has Asperger's, has ADHD, was born addicted to methamphetamines when we adopted her. It's been a huge impact. And then my oldest daughter, who is 17 and a half, is beginning her senior year in September. So Ken will miss most of her senior year because he will be deployed. A lot of it has to do with the care for our youngest daughter, who sees psychiatrists. Most plans don't cover the type of care that she needs. The medications aren't covered. Just finding basic care for her is extraordinary, and it's not fair that kids and families have to suffer. If I had one thing to tell a lawmaker, it would be that this reform is imperative to pass so that our working men and women, our working families, do not have to make the ultimate sacrifice of enlisting into the military to provide for health care for their families.